Stages of labor. Labor is divided into 3 stages. The first stage is the dilation of the cervix. The second stage is the birth of the baby. And the third stage is the delivery of the placenta. For first-time mothers, labor takes around 12 to 14 hours. Women who have undergone childbirth before can expect about 7 hours of labor. Recognizing the start of labor. Braxton Hicks contractions are sometimes mistaken for labor. These false contractions usually start halfway through the pregnancy and continue all the way through. You may find these contractions visibly harden and lift your pregnant belly. It is not known what triggers the onset of labor, but it is thought to be influenced by the hormone oxytocin, which is responsible for causing uterine contractions. Symptoms of going into labor. Some of the signs and symptoms of going into labor may include period-like cramps, back pain, diarrhea, small blood-stained discharge as your cervix thins and the mucus plug drops out. This is called a blood show. A gush or trickle of water as the membranes break in contractions. First stage of labor. The first stage of labor involves the thinning of the cervix and its dilation to around 10 centimeters. The first stage is made up of 3 different phases. The latent phase, generally, this stage is the longest and the least painful part of labor. The cervix thins out and dilates 0 to 3 centimeters. This may occur over weeks, days, or hours and be accompanied by mild contractions. The contractions may be regularly or irregularly spaced, or you might not notice them at all. The active phase, the next phase, is marked by strong, painful contractions that tend to occur 3 or 4 minutes apart and last from 30 to 60 seconds. The cervix dilates from 3 to 7 to 8 centimeters. The transition phase, during transition, the cervix dilates from 8 to 10 centimeters, that is, fully dilated. These contractions can become more intense, painful, and frequent. They feel as though the contractions are no longer separate, but running into each other. It is not unusual to feel out of control and even a strong urge to go to the toilet as the baby's head moves down the birth canal and pushes against the rectum. Second stage of labor. The second stage of labor is from when your cervix is fully dilated to the time your baby is born. The contractions during this time are regular and spaced apart. As each contraction builds to a peak, you may feel the urge to bear down and push. The sensation of the baby moving through the vagina is described as a stretching or burning. Particularly as the baby's head crowns, means appears at the vaginal entrance. At the time of birth, a doctor or midwife may guide your pushing to enable a gentle, unhurried birth of your baby's head. Sometimes the umbilical cord is looped around the baby's neck. If possible, the doctor or midwife will loosen it, loop it over your baby's head, or clamp and cut it to allow your baby to be born safely. Once the head has emerged, your midwife or doctor will guide your baby's body so the shoulders come out. The rest of the baby will then follow. If this is your first baby, the second stage of labor can last up to 1 to 2 hours, particularly if you have had an epidural. If you have had a baby before, this stage is often much quicker. A long second stage of labor can result in risks for you and your baby. Third stage of labor. After the birth of your baby, your uterus gently contracts to loosen and push out the placenta, although you may not be able to feel these contractions. This may occur 5 to 30 minutes after the birth of your baby. The muscles of the uterus continue to contract to stop the bleeding. This process is always associated with a moderate blood loss up to 500 milliliters. In this stage of labor, one of the potential problems is excessive bleeding or postpartum hemorrhage, which can result in anemia and fatigue. This is why the third stage is carefully supervised. There are two approaches to managing the third stage. One, active management. After the birth of your baby, the midwife or doctor gives you an injection of oxytocin, clamps and cuts the umbilical cord, and then carefully pulls on the cord to speed up delivery of the placenta. Active management has been found to reduce excessive blood loss and other serious complications. To expectant management, the placenta is allowed to deliver on its own, aided by gravity or nipple stimulation only. In this approach, the umbilical cord stays connected to the baby until the cord stops pulsating. Monitoring your baby during labor. During labor, your baby's heart rate will be checked regularly. If you have had a low-risk pregnancy and there are no problems at the onset of labor, your baby's heart will be listened to every 15 to 30 minutes using a small handheld Doppler ultrasound device or Pinard or fetal stethoscope. This equipment can be used regardless of the position you are in. If you had problems during pregnancy, or if problems arise during your labor, your baby's heart rate may be monitored continuously using a cardiotachograph or CTG. Care of the perineum during birth. The area between the vagina and anus is called the perineum. As the baby's head starts to crown, the perineum will tear if it can't stretch enough. These naturally occurring tears can be difficult to stitch and may not heal very well. In around 3 to 4% of cases, the vagina tears right through to the anus. An episiotomy is an intentional cut of the perineum using a pair of scissors. This clean cut is much easier to control and repair, tends to heal better than a tear, and is less traumatic to the underlying muscle and tissue. An episiotomy may be needed during the last part of the second stage of labor if the birth needs to be quicker, if you or your baby show signs of distress, you need an assisted vaginal birth, you are showing signs that you may tear badly. Episiotomies should be performed only if needed. What triggers labor? It results from a series of biochemical changes in your uterus and cervix. Both your body and the fetus have a role in these changes. Your cervix has to go from firm and closed during pregnancy to thin and dilated, and your uterus has to start contracting. Experts believe that when the fetus is ready for birth, it releases a small amount of a substance that triggers your hormones to start the labor process. For most people, this happens naturally between 37 and 42 weeks of pregnancy. In some cases, a healthcare provider will induce labor or kickstart. Two main components of triggering and maintaining labor include prostaglandins. Uterine cells produce prostaglandins, a hormone-like substances, to help dilate your cervix and cause uterine contractions. Oxytocin. When the fetus's body pushes against your cervix, it stimulates your pituitary gland to release oxytocin, a hormone. Oxytocin travels to your uterus and stimulates contractions. Thank you.